Hi, this is Dr. Grove Higgins. This is number one of a series of videos that I'm going to be doing, interviews with other practitioners here in Colorado Springs that I do business with as part of my community of practice. A friend and I were discussing about how do you build a community of individuals to help our clients. And instead of building a cult around a certain individual that gets certain results, I tend to go to my community and try to involve the person's other practitioners, therapists, doctors in their care. And so we built a community around the individual instead of around the practitioner. So this is number one of those videos. Today I'm going to be doing an interview with a friend of mine and my dentist, Dr. Erick Anderson. Dr. Anderson, you're now a second generation dentist, right?
Yes. Yeah, I'm in first, my father.
With your father. Can you tell us a little bit about what it is that you do and how you got into it?
Actually, I got into dentistry because I saw that it was a great profession through my dad. And he's had a wonderful career being able to take care of people and really make a difference in people's lives. And so it sounded like something that I was interested in doing, and so that's how I became a dentist.
Mm-hmm. And how long have you been in practice now?
I've been in practice since 1998.
Okay.
Yeah.
And how long is the schooling typically for a dentist? How similar is it to other professions?
It's similar. Typically, you'll get a college degree from a four-year university, and then after that you'll then go to dental school, which is also 4 years, and then often, like in my case, I did a residency, a one-year residency after school. Okay.
And is that in a hospital setting? What's that kind of a setting?
In my case, it was a general practice residency in the Naval Hospital at Camp Pendleton.
Okay, so you saw a lot of different types of disorders outside of just cosmetic and hygienic type of issues.
Right. Way beyond just the teeth.
Right. Okay, very good. So one of the things that I'm very interested in is how just the general hygiene and daily use and abuse that our teeth go through, how does that affect a person's health overall?
Oh, well, in a lot of ways, actually. I mean, I always feel like the mouth is part of your body, and a lot of times different diseases will manifest themselves in the mouth, and so a lot of times we'll see things in the mouth that indicate maybe a more systemic problem, and there's also many studies now that are documenting a relationship between things like diabetes and periodontal disease, and also cardiovascular disease and periodontal disease. And there's many other things that show up in the mouth that indicate that you have a systemic problem.
Sure. Diabetes being one, what's a fairly common disorder that you see that's lifestyle driven outside of diabetes?
That's lifestyle driven?
Like heart disease and other things like that.
Heart disease, and of course the relationship isn't clear if you end up, if the bacteria in the gum disease is causing the heart disease, or if it's just something to do with the way people's bodies deal with inflammation, because some people's bodies deal with inflammation, which is really what periodontal disease is, and some people's bodies deal with it poorly, and they have tissue breakdown, and then others, their bodies don't deal with the inflammation the same way.
Right. So moving on, I mean, I know that in my younger years, and the sins of my younger years, led to a lot of dental work, and as I've gotten older, that some complications have come from all of that. And right now, of course, I'm dealing with some cracked teeth that you've helped to repair and whatnot. Individuals sometimes don't go and get those things fixed.
Right.
And I know from my practice that sometimes leads to other problems in other areas, particularly of the jaw and the face and the neck. Yes. Can you explain how that all comes together?
Well, there's Are you referring specifically to things involving the joint, or because there is a relationship between the joint and the muscles in the teeth,
Right.
And a lot of times if there's imbalance somewhere in that system, it'll manifest itself either with joint problems or muscle dysfunction or tooth problems. Like a lot of times if there's a joint problem or a occlusal disharmony, you'll see in people's mouths they'll have lots of wear on their teeth, or they'll have broken teeth, for instance. So there's a lot of dental signs when the system's out of balance.
Gotcha. So what are some of the things that cause that imbalance that you come across?
Well, you can have trauma. Trauma can obviously cause that. A lot of times it is parafunctional habits or habits people have, like grinding their teeth. A lot of people grind their teeth either through tension or stress, and especially at night. And a lot of times they'll grind patterns into their teeth, and they'll kind of grind themselves into a position that doesn't coincide with where the optimal joint position should be.
Right. So ideas of trauma would be things like whiplash from a car crash, a bike accident, sports,
Yes.
that type of thing. Direct trauma, of course, to the jaw. And then how does, there's a lot of people that have grinding. How does that come up?
Well, some people are grinders, some people aren't. But there is a component to this that has to do with how your teeth fit together. And the theory is, if optimally you'd like your joint up here to have the condyles seated, where you've got a disc that sits on top of the condyle, and that sits in the fossa, and you'd like that to all be aligned. But oftentimes you'll have interferences with the teeth where the teeth want to close together is not exactly where the joint wants to be in the socket up here. Mm-hmm. So what that means is it takes muscle. It's a muscle position then, because the muscles have to contract and try to get the teeth into the optimal position. Mm-hmm. And so it's causing constant firing of the muscles to get the teeth into that position. So from a dental standpoint, what we try to do is eliminate any interferences in the teeth to allow the joint to seat back up in its optimal position.
Okay, and how do you go about doing that typically?
Usually first after we've diagnosed really what the problem is, what we probably first do is do something that's very conservative and reversible, which is splint therapy.
So making a brace, a bite.
Right, we'd make a brace that essentially eliminates any interferences from the teeth, which would thereby allow the joint to be able to seat up in its correct position.
Right. And outside of, if you don't do those types of things to correct the alignment with the bracing or bite guard or something like that, the joint's going to wear and tear abnormally. But
Yes.
there's also changes in your bite, in the way that the teeth behave, the bone
Yes.
grows and things like that.
Right. Well, and some people can have, it's a kind of a three-part system. There's the joint, and then the teeth, and then the muscles. And some people, depending on where the weakness is in the system, that's where they will manifest the problem. So some people, if they've got interferences in their teeth, but they have really strong muscles and strong joints. Well, they'll just end up grinding their teeth down. And so you'll see it in the teeth, but their joints will feel okay, and their muscles will feel okay.
Right.
Other people, they might not have super strong muscles or a strong joint, but they'll sometimes have a little bit of wear in their teeth, but their breakdown's going to happen in the joint.
Sure.
Or it's going to happen in all three places. You can have all three places break down.
Right. Right. So what are some of the signs and symptoms that a person would experience if they were having this, and what we're talking about now is TMJ disorders, or temporomandibular joint disorders. what are some of the signs and symptoms that somebody would feel, and go out as far as you can from, you know, pain right there?
Yeah, I mean, a lot of times what you'll have is pain. You can have, well, first of all, most people will have headaches, you know, because there's many different muscles that are involved in opening and closing, and if you get discoordination or continual, if you're continually firing these muscles, they'll end up being in kind of a chronic state of spasm, and you'll have pain up in here, down through the sides of your face, and it'll be kind of a generalized pain, but you'll have headaches. Then you know, if that progresses and you end up having damage to the joint, then you can start having pain up in right around the ear that many people think is earaches, but it's actually TMJ pain. And it can go down through your lower face down in here, and a lot of people will mistakenly think that it's a tooth that's causing the pain, but it's all related to the TMJ and the joint and the muscles.
Right. And of course I've seen a lot of that with my car crash victims who have jaw issues, and then it can even have ringing in the ears associated to the jaw, and other facial pain, and even pain into the eye. I've seen that when they got the brace, and after a week the eye improves. So we can't look at just right where the pain, where you think it is. You have to consider what's attached to it, and how, because body can pick wherever it wants to put the pain. Looking at treatment, so you do bracing, and you do some other things. Have you ever utilized other practitioners to help individuals with that kind of pain, knowing that there's muscular issues, joint alignment issues, and such like that?
Yes, because sometimes when somebody gets in one of these pain cycles, once we eliminate the bite problem with the teeth, some people, usually that provides some relief for the patient, but it doesn't always provide relief for the patient. Sometimes they need additional help with either a chiropractor or a physical therapist to work on the muscle part of things, and try to get the muscles to kind of all relax and to break the cycle. Right.
And you feel that it's a very successful treatment by itself. How much of the percentage of the time, I should say, of the time that just the bracing will fix the problem? And how many of those individuals do you think really need extra care?
I think probably 75% are helped with the bite splints, the bite therapy. And a lot of times, if that's successful, if there's some obvious problems with their bite and their teeth, at that point sometimes we'll actually do correction on the teeth, do some full mouth bite adjustment, or restore the teeth and try to get an optimal bite, you know. And some of those people you also have to do surgery and orthodontics to get the bite corrected.
Sure. So, just one more question, so that way people get an idea of when they should start suspecting that they should go see their dentist and whatnot. Outside of pain, what other things are you looking for?
We're looking for things like decreased opening. Like, a lot of these people can't open all the way, because, as you know, the joint appears tremendously complex. So it both hinges and slides. And so a lot of times somebody will be able to open partially, but that's because the first 20 millimeters of the joint opening is a hinge action. Then after that, the joint needs to slide, and if you have a disc derangement in there, a lot of times you won't be able to open all the way. Your jaw won't be able to slide forward. So jaw limitation in jaw opening. Pain, popping, clicking, kind of any crunchiness up here in the jaw joint, or if you've experienced any changes in the bite, because a lot of times if you have inflammation on one side or the other, the teeth all of a sudden won't feel like they line up properly. me.
Okay, so there's quite a few things to look at, and the best bet is to get at least a consultation just to see what else is going on.
Just kind of see what's going on.
Right,
yeah.
right. So from my point of view, you know, as a chiropractor and a trainer of 24 years, strength conditioning coach and such, there's a lot of people that I've run into that have a lot of those types of things outside of pain, popping, clicking, and just the general feeling that something's not quite right there. And referring out those individuals, if you can't fix something within 2 or 3 times, my general rule is send it out, get a referral. If it comes back, then you probably just need to keep pushing the button a little bit more. But thank you very much for your time, and we'll be we'll do this again on some other issues, because you know, we cross over in the head and neck all the time. Me, a chiropractor, him, a dentist. So so check back again, put a comment in the boxes below, and we'll see you on the next one.